Today we'll be doing a knee assessment on my roommate, Nick. So, Nick, what we're going to have you do is stand straight, look at me. So now from here we're determining, we're assessing your weight distribution, your posture, your knee and hip alignment. So then I'm going to have you stand on one leg and do a single leg squat. I'm going to have you do one more time. So you can tell from the shakiness of the movement that his glutes may be weak. Now I'm going to have you lay flat on the table. So then from here, what we can do with his legs is we can determine the leg length and see if his hips and knees and his ASIS are in alignment, and then we can palpate his ASIS for any tenderness. And then from this position, we can bend your knees and put your feet flat on the table. Bend your knees and put your feet flat on the table. And from here, we're going to see if the ASIS and the pubic bone are still even, which they seem to be. So then from here, we're going to have you put your feet back flat on the table. I'm going to have you do a straight leg raise. This is going to determine the range of motion. So I'm going to grab your heel and your quad up to here. If we can do that one more time. And that's a good indication. It's a 90-90 test. So now we're going to bend your knee. And this is another example of a range of motion test. And from here, we're going to internally and externally rotate his knee to see if there's any tightness. And you can see that externally is a little bit of tightness here. So then we're going to have your knee go back down. We're going to palpate your adductors and your psoas. Oh, sorry, and your side. So now we're going to palpate your adductors and your psoas. And from here, we're going to do a Thomas test, so lay back flat on your back. And now you're going to pull your knee to your chest, all the way with your hands. And then you can see the indication that his leg is flat here. It's not coming off, so it would be a negative test if the knee started to bend. But he seems to be okay there. So put your knee back down. Now we're going to pull your knee to your chest one more time. And from here, we're doing a quadrant test and seeing if there's any clicking or popping. And this would indicate a tear. So then from this point, I'm going to have you lay on your side completely. And now we're going to palpate the greater trochanter and down his ITB to determine any tenderness or pain that may happen. And now, to assess your glute strength, I'm going to lift his leg in the air, bend his knee, pull it back, and you're going to have to try and hold this position when I let go. So you see how he kind of dropped it a little bit? It means he might have a little bit of weak glutes, but we'll pull that back down. And now the over test, we're going to have you put your knee close to the table right here. And that his knee can touch the table is a positive over test, so he does not have a problem here. Then we're going to have you lay on your stomach. So again, we're going to palpate the ASIS, his glutes, and his hamstrings to see if there's any tenderness. And from here, I want you to do a single leg raise. And one more. And this is indicating which muscles are firing faster, which might be compensating for another muscle. So then the next exam will be an Eli test, which will be a pulling his knee into his butt. I'm trying to go a little bit further. So that would be a negative Eli test, meaning he has tight psoas and tight hamstrings. So then we're going to have you lay back on your back. Oh, what happened? Did it stop? No. Oh, still going. Cool. Okay, and now we're going to do the meniscus exams, the McMurray exam. So we're going to palpate the meniscus to see if any tenderness or pain. And then from here, we're going to lift the tibia and down, lift again. And then from here, we're going to internally rotate and continue to lift the tibia. And then, internally rotate. And then externally rotate. And now pull your knee into your chest and internally rotate. Oh, that's external. Externally rotate and then internally rotate.